Okay, so what is schizophrenia? So definition term of schizophrenia is to have abnormal behaviors, hallucinations, delusions, and disorganized thinking. So the disease was first identified as a discrete mental illness by Dr. Emil Kraepelin in 1887. The illness itself is generally believed to have accompanied mankind through history. So schizophrenia started getting observed in 1908 by a Swiss doctor named Eugene Bleuler to describe the splitting apart of mental functions that he regarded as the central characteristics of schizophrenia. Schizophrenia actually is a Greek term that means split mind. When people have schizophrenia, they usually interpret reality abnormally. They can have a combination of hallucinations, delusions, and extremely disordered thinking. So when you have schizophrenia, you can also have a range of thinking with cognition. And cognition meaning mental action of processing and acquiring knowledge and understanding through thought, experience, and senses. They can also have problems with their behavior and their emotions. Not everyone is born with schizophrenia. Sometimes you can develop it through stress, drug abuse, traumatic events in your life. Even just life-changing events going from 0 to 100 can cause schizophrenia. Children whose mothers experience famine during the first trimester are more likely to develop schizophrenia. Also, pregnancy and birth complications lead to a more higher risk for schizophrenia.
A diagnosis of schizophrenia is made if a person has two or more core symptoms, one of which must be hallucinations, delusions, or disorganized speech for at least 1 month. The other core symptoms are gross disorganization and dismissed emotional expression. Other symptoms include having a lot of energy or being overly active, which is a state called catatonic, in which the body becomes rigid and cannot move, talking in sentences that do not make sense, do not washing or grooming, cutting themselves off from family, friends, and outside world, being unable to function in school, work, or other activities, losing interest in life, behaving in strange ways, being very sad or depressed, such as mood swings, having dulled emotions, and being inactive. For treatments, the main types are counseling and medicines to lessen or stop psychotic symptoms. Medicines will control psychotic symptoms in most people. In milder cases of schizophrenia, medicines may not be needed. Overall, the medicines can stop or lessen hallucinations, help the person tell the difference between hallucinations in the real world, lessen or stop false beliefs, lessen feelings of confusion, and help the person think more clearly.
Alright, the term schizophrenia is about 100 years old and was first diagnosed by Dr. Emil in 1887. Although the term is only about 100 years old, it is believed to have been around throughout all of history. Schizophrenia is skewed by social media, and it is shown as how it used to be rather than how it is now. Now, there are many medications and treatments that one can take to live a healthy and normal life. I'm going to talk about three different cases. Some of them are people that were able to live more of a normal life, and two of them are ones that struggled more and didn't have as good of an outcome. So Lionel Aldridge, he was a football player that helped the Green Bay Packers win the first 2 Super Bowls. His case was diagnosed early and he was able to be treated. And when his case happened, it was more recent than the other 2 cases, so there was treatment for it, and he was able to live a more normal life. And next we have Edward Einstein, son of Albert Einstein, who unfortunately lived with a more unstable case of schizophrenia that caused him to live in an asylum for over 3 decades, and he later died due to a stroke. And then we have a more debatable case, and that's for a couple of reasons. We have Vincent van Gogh. Although he was not necessarily diagnosed with schizophrenia while he was alive, there are a lot of reasons that lead people to believe that he did have schizophrenia. The first thing is that a lot of the people that were close to him believed that he heard voices, and As we all know, due to social media, that is one of the symptoms or things that schizophrenia is more known for. And then the next thing is during his life, he did go through an episode of depression where he ended up cutting off his ear, or part of his ear, where he then created a very well-known piece called A Self-Portrait with a Bandaged Ear. And this, a lot of people believe that he cut off his ear because he was hearing voices. Other people believe it was because he was depressed and he was going insane. Alright, the next thing is Van Gogh did die of a gunshot. Some people say that he was shot from far away, and others say that he shot himself. Now, let's say he did shoot himself. All these signs kind of point towards schizophrenia, and although he wasn't diagnosed with it, this is more of an interesting case, and depending on how deep or how far you go into the internet, you'll find different things. Even just a couple of links in, there are a lot of different hypotheses and ideas of what did happen and what he was diagnosed with, but this was more of an interesting case and a very sad case. But these were just some of the cases of very well-known people to show that in more recent times it is more possible to live with this illness through medication and treatments.
Myths and facts about schizophrenia. People believe that having schizophrenia means you have a split personality. That is false. Having a split personality is a dissociative identity disorder, whereas schizophrenia is the sense of a false reality. Myth number 2. Schizophrenic people are armed and dangerous. False. That is only true in movies. People with schizophrenia can be unpredictable, but most are not violent, and are more likely to harm themselves than others. Suicide rates are high among schizophrenic people. Myth number 3. Schizophrenia is the cause of bad parenting. That is false. It is not the mother's fault, it is a mental illness. Schizophrenic people are not smart. The stereotypes don't hold back for anyone. Watch out. Explain to me John Nash, the schizophrenic with the Nobel Peace Prize for his work in economics and mathematics. That's right, schizophrenic people are smart. Myth number 5. If you have schizophrenia, you will live in a mental hospital forever. Not true. However, that was the case back in the day. People were sent to asylums and even prisons. But now more is known over the mental disorder, and people can live with their families. Myth number 6. You can never recover from schizophrenia. Although schizophrenia is hard to treat, it is not impossible. Antipsychotic meds help stabilize you. Talk therapy and behavior therapy help you handle stress to live a better life. Through the right medication and therapy, about 25% of people will recover from schizophrenia. Another 50% will see major improvements, and many will live a productive life.